I think, Corey, the reason you had such a big turnout is you may have told people there'd be lunch provided today, and but I'm the lunch. So for some people in this room, I'm sure you're exactly right. So anyway, it's thank you for having me. I've always enjoyed coming before this organization, both as a member of the minority party when I was in the General Assembly for 6 of the 8 years, and coming back with different other roles and responsibilities. So I'm the keeper of the public purse, and for those of you who do not know, the Treasurer's Office contains the 26th largest pool of public money in the entire world. And on the pension plan, over 1 out of 10 adult North Carolinians gets a check out of the pension plan every month. In addition to that, we manage the state health plan, and the state health plan is the equivalent in size to the domestic employment base of Amazon, Berkshire Hathaway, and J.P. Morgan combined. So when we start talking about, my wife always says don't talk in terms of billions, but sometimes you just have to because that's what we manage. Every 30 days, we are spending nearly $740 million. Not for police cars, not for school classrooms, generally speaking, just for the health care, pension, pharmaceutical, and the interest on the debt. Nearly $750 million every 30 days. So when you look at the enormity of the responsibility, over the next few minutes, I'm gonna say some things to you. But the first thing I want to say is that, unlike my wife, and many of you know Cynthia, she's a tour guide at Old Salem, and John Hood loves this description of her. I always say she's the cutest 250-year-old woman you've ever met in your life. Sounds like something you'd say. And the reason is that when she goes to work every day, she wears the period costume of 250 years ago, because that's what you do when you're a tour guide at a Moravian community like that. But what's different about what she does every day, in addition to being an artist and a musician and a singer, is that I work on the invisible. Every day, I and the people at the Treasurer's Office work on the invisible, things you cannot see and you can't hear, unlike a tour at Old Salem, unlike a performance. We work on the invisible. But this invisible thing is going to dominate the public policy of North Carolina for the next 20 years. I would like for all of you to think about how you would complete this sentence. The single biggest threat to public education is... The single biggest threat to public education is how states account for and fund their unfunded pension and health care liabilities of public service workers. That is Bill Gates 8 years ago. Also nearly 8 years ago, which I'll get into in a moment, the state auditor, respective to the state health plan, says that the state health plan, even though it spends over $3 billion per year on health care and pharmaceutical benefits, is at risk for overpaying claims because the plan's auditors do not have access to the vendor contracts and cannot verify that the state is receiving the proper contractual discount. So there's lots of things that happened 8 years ago. We'll get into those in just a moment. But the fact is that going back to the Bill Gates quotes and the Warren Buffett quote, these issues, which are not political and not emotional, but simply mathematical, are going to dominate public policy in North Carolina for the next 20 years. Not because I'm the treasurer. Whoever the treasurer was going to be would be saying the exact same thing. And it's mathematics. So simply put, let me fast forward through some things so that we have plenty of time for questions for the audience. Number one, the pension plan is one of the best funded in the United States. But unfortunately, and that's relatively speaking to the other states, but our pensioners cannot pay their health care, Our pensioners cannot buy groceries at Harris Teeter or pay their Duke Power bill with relativity. Right, Representative? They actually want money for those things. So the fact that we have one of the 5 best funded pension plans in the United States does not mean that we don't have headwinds. Now, this pension plan, for those of you who may be critical of pension plans, I want you to know that every public service worker in this state or at the local or the county level, each of them puts money in this pension plan every single month out of their paycheck. Obviously, the employer that they work for put money in the pension plan on behalf of that individual. But at a 30-year period of time, that money has to grow in order to pay out a benefit. The challenge is that the state pension plan has not achieved its assumed rate of return on average now for 21 years. So when you're dealing with the 26th largest pool of public money in the world, and it doesn't perk on average for 21 years, you have a problem. Now you should be thinking maybe, gosh, if we have this problem and we're one of the 5 best funded, what's South Carolina and Kentucky thinking about? The South Carolina pension plan is only 53% funded this morning. The Kentucky retirement system is 30% funded this morning. And the challenge is I'm 60 years old, and this is the last 50 years in terms of the state pension plan. The blue line represents interest rates. Some of you, like me, bought a house right up in this port right here. Prices were low, though, so it was okay. Now, the red line, the blue line is interest rates. The red line is the assumed rate of return. It doesn't matter how unathletic you are. If you're the state treasurer in North Carolina and the blue is above the red, you're going to be great, because all you've got to do to hit your number is to go and put money in treasury bonds, and you're golden. So what happened was, when I was in high school, the assumed rate of return, as interest rates went up, the assumed rate of return was raised, which means that less money was asked to be put in the plan because you were more optimistic about what it would earn. In addition to that, the multiplier, which is what you multiply the state employee's average yearly pay times their years of service. So if you have 30 years in the system, it's about 54% of your income. So when interest rates went up, the red line was raised, which means less money was coming into the plan, and then the green line was raised dramatically, which means that a lot more money was leaving the plan for the rest of our lives. There's another line that's not on here. It's the purple line. The purple line represents life expectancies. For females in this room, if you went to work for the state at the age of 20 or 21 years of age and you're able to retire at 51, you're literally going to be retired for longer than you worked. Now, that's a blessing. But it's not a blessing when you look at this mathematically, because in the late 60s, the minimum retirement age was taken out of the pension plan. This plan has no minimum retirement age as of this morning. So these issues are not emotional and not political, but they're mathematical. So what can we do about this when you have the responsibility of being in the check delivering business? Well, the only thing we can do is make sure that money is not leaving the plan unnecessarily. When Harlan Bowles left the Treasurer's office in the year 2000, the amount of Wall Street fees that this plan was paying was $50 million a year. When I was sworn in as state treasurer, the Wall Street fees were nearly $700 million per year. So in 16 years, the Wall Street fees had gone from 50 to over $700 million per year. So we've been really successful in cutting Wall Street fees. We're on a 4-year run rate right now of cutting Wall Street fees by over $400 million on a 4-year run rate. But the other thing, and unfortunately these issues get a little more tragic as I go through them, is that we're finding people who are cashing checks of individuals they know to be deceased who are participants in these plans. And we're putting them in jail. We had one person who had been cashing his deceased mother's pension check for 16 years. This is one participant. There's 900,000 participants on this plan. And I don't want anybody to think, I hope you don't think I'm yelling at you. I want to make sure you can hear me in the back. But I also want you to know that, as Coach K once said when they asked him about his courtside manner, he said, there's some things that happen right in front of your eyes that are worth getting mad about. When somebody is cashing a check of a person they know to be deceased, that's worth getting mad about. This one individual, this one overpayment for one of the 900,000 people resulted in over $266,000 leaving the plan just for that one case, David. But then, unfortunately, it gets more tragic because we have elected officials across North Carolina who put their left hand on the Bible and they raise their right hand to uphold the Constitution and the laws of this state and our community, and they commit crimes while on their public service duties. So we have a felony forfeiture statute that we are evangelically putting into use. The first person that we had to exercise this on was a Republican member of the North Carolina Senate. The last person that we've had to exercise this on is a Republican Register of Deeds of Wake County. This is all public record. My point is that when it comes to the laws that the General Assembly writes and become properly ratified, we do not pick and choose which laws to apply and who to apply them to, because that's not what you do as the keeper of the public purse. As a fireman said to me last week, Ms. Treasurer, one thing that I like about you is you've never forgotten there's no Democrat or Republican fires, there's no Democrat and Republican crimes, there are no Democrat and Republican roads, there are just crimes, roads, and fires, and you always treat everybody as it's their money, not yours. So those are some of the things that are going on in the pension plan, but obviously, even though it's one of the 5 best funded in the United States, it's going to be very difficult, and the main reason is that this pension plan on a gross basis paid out $6 billion in benefits last year. That exceeds, Representative Warren, the amount of state debt. We paid out more in pension benefits out of the Elders and the teachers system on a gross basis than the amount of state debt in North Carolina. There were no earnings in the plan last year. 0, negative actually. We're estimating that 10 years from now, instead of 315,000 participants getting one of these pension checks, it's going to go to 475,000, and the gross payout is going to go from $6 billion to $9 billion bucks a year, and it's going to stay that way for a long time. So let's talk a little bit about the state health plan. The state health plan is insolvent. The state health plan, if you look at the Pew Research, and I have it right here as you probably can imagine, the state health plan is only 4% funded. You should all be asking yourself, if you're listening to what I'm saying, how could the state treasurer be standing before us and say that the pension plan is one of the 5 best in the United States and the health plan is one of the 5 worst in the United States? And the answer to that question is it's not emotional, it's not political, it's mathematical. For 40 years, promises were made to state employees to be eligible for lifetime health care in North Carolina, and no money has ever been set aside for that purpose. Now, I'm often criticized by saying, this is some new GASB standard, or this is something the treasurers just want to start talking about. The fact is, not because I'm from there, the city of Winston-Salem saw this 34 years ago. The city of Winston-Salem has an $86 million unfunded health care liability, and they have $59 million sitting in the bank to pay for it. The unfunded pension health care liability of North Carolina is over $30 billion. So Harlan Bowles said it 39 years ago that these little understood unfunded and pension health care liabilities, he didn't use the price of promises, but these little understood unfunded health care and pension liabilities will eventually equal, exceed, and dwarf the state debt. As we sit here this morning, that number is tenfold. Our total unfunded pension and health care liabilities are about 10 times what the state debt is right now. So what Harlan Bowles said in his report 39 years ago, former state treasurer, considered the best state treasurer of the 20th century in the whole United States, not just of North Carolina, is actually coming true. So on health care, what are we doing about that? And why should you care? The reason you should care is that when you wonder why anything, why that road's not built in the next 20 years, why there's not a cost of living adjustment for retirees, why there's not the pay raise that some would desire in public education. If you want to know why anything, you're going to be able to point back to the Treasurer's office for the next 20 years and get an answer to your question. Just on the pension contribution, the bill that I'm getting ready to send the state agencies, some of who are represented here today, is nearly 13% of payroll. So for every state employee, not including health care, 12.98% of whatever that person makes has to be sent to us this year just to fund the pension plan. It's the invisible. So going back to health care for a moment, going back to what the auditor said, going back to a Pulitzer-nominated report, that the series that the News and Observer did 7 or 8 years ago, going back to what Warren Buffett and Bill Gates said 7 or 8 years ago, we set about to figure out not what people are charging us from health care, but what we're supposed to be paying. So contrary to what you've been hearing and what you've been reading from some very people in this room, we started this last summer. Last summer, we convened a meeting in a room about this size with about half as many people. Legislative staff, Treasurer staff, Blue Cross Blue Shield, Hospital Association, Medical Society, primary care physicians, behavioral mental health folks, all across the gamut. And I started that meeting by asking a rhetorical question: how much waste, fraud, and abuse do you think there is in the state health plan? And the wide ranges from the experts of the heads of those organizations were 12 to 15%. And from Blue Cross Blue Shield, from the Special Investigative Unit, which investigates waste, fraud, and abuse, possibly 15 to 25%. So I stepped back from that meeting while the meeting was going on. I said, we're in great shape here. I need to cut about 15% out of the cost of this plan. The reason I have to do so is that it's unsustainable, number one. Number two, the governor's budget and the General Assembly's budget only funds us at a 4% increase, and you all know that our health care and pharmaceutical costs are going up much more than 4%. So we left that meeting, and I charged all the people who were participating. I said, come back to us with ways that we can cut 15% out of the cost of this system. And I promise you, as the state treasurer and the executive director of the state health plan, that we will operationalize those things. No concrete advice came back to us. Now, this is not just me saying this. This is the U.S. Institute of Medicine, who talks about the sources of waste, fraud, and abuse in North Carolina, in the U.S. healthcare system. Unnecessary services, excessive administrative cost, inefficient delivery of services, prices that are too high, and fraud. Those are the things that they're interested in. In addition to that, as many of you know, we have something I refer to as the state hospital. It's called UNC Health Care. So we sent a request to UNC Hospital for them to tell us not what they're charging us, but what are we supposed to be paying. Last year, we sent UNC Health Care over $300 million just for health care for state employees. When I received the response back in this thick envelope, I was looking forward to a price list of what an appendectomy, a tonsillectomy, or a knee replacement costs at UNC Health Care. I know how smart and photographic you all are, so this is what was sent to me. Every single page was redacted. So as Corey Friedman at the Wilson Times said, and I'll say it a little more sarcastically than he put it in his editorial, let's get this straight. The state treasurer cannot find out from the state hospital what the state health plan is supposed to be paying for state employees' health care. If that bizarre sentence gives you a headache, we hope that it will subside before you're in need of any medical attention. Lord knows what a neurologist is going to charge you to diagnose this. The fact is that everybody knows this is going on. So after we had our meeting, we had no examples of how to really cut waste, fraud, and abuse out of the system. So we came up on what we're going to be doing starting next year, which is reference-based pricing. What reference-based pricing does is it increases transparency of the state health plan, it lowers costs in the state health plan, and it does something that's never been able to be done, which is push the power down to the consumers. I know some of you personally, and I know that none of you pull a credit card out of your pocket unless you know the value and the price of what you're getting. None of you. But all of you are forced to pull a health care card out of your pocket, and even after you consume it, you don't know the value and the price of what you got. That's what we're trying to get to the bottom of. Reference-based pricing is not something that's new. And what it looks like is that we have tens of thousands, I guess, Andrew, of CPT codes. These CPT codes tell you what the reimbursement rate is. Now, what we're doing in this plan is we're trying to exalt and affirm primary care physicians. Primary care physicians are shrinking. And if you look at the expose that was in the Wall Street Journal recently about what happens to the referral process once a primary care physician is swallowed up by a big entity, the referrals go up 7 to 8 times. I have an example in this stack of papers here from a teacher in Fayetteville, so let's personalize this just for a minute. This person was referred before Thanksgiving to get an endoscopy. They were referred into the people who do that type of procedure that was part of the group that owned the doctor that referred them in. They woke up to get this procedure and the person said, "It'll be $1,200, please." And he said, "Well, I don't have $1,200. And the person said, "Well, we can put you on payments." "Well, I can't afford payments. I'm a school teacher in Cumberland County." And he said, "Just for curiosity, if I did have $1,200 to give you right now, what would be the total cost of this procedure that I'm getting ready to get?" And the person said, "Well, we would never be able to tell you that." And she didn't say that like she was withholding information. Nobody knows. And how can you cut the cost of something when you don't know what the costs are? So at the end of the day, this person took this negative experience, and over the next 6 days, they were able to get this procedure driving 28 miles from their house for less than $250. My point is that when we increase transparency in the state health plan, when we reduce costs in the state health plan, and we push the power down to these state employees who know how to buy the cheapest gasoline, know how to go to Harris Teeter like I do on Thursdays, know where all the Vic specials are. You can tell how old I am now, right? So the young people are not getting that at all. Oh, you get it? You're not claiming that special when you go in there, are you? Okay.
I took my phone number in. I still get a discount.
Okay. But the seniors, oh, the college discount. All right. I haven't tried that one. But, and I never will. So anyway, the point is that when you push the power down to these consumers who know how to consume in every other aspect of their life, North Carolina can lead its way out of this situation. You know, when Pew Research and Standard & Poor's tells you that you have one of the most insolvent state health plans in the United States, that is a very serious matter. Because as Bill Gates and Warren Buffett says, money that is going to be taken away from things that people care about in order to pay for these unfunded liabilities. So the total of this is that our goal is to save $300 million in the state health plan. But as important, there's going to be $65 million of money saved by the employee themselves in the form of co-pays and deductibles. So we're giving pay raises to most primary care physicians because we think it's in the best interest of North Carolina for primary care physicians to be able to stay independent and refer you to whoever the best carpenter is, whoever the best electrician is, or whoever the best plumber is. Obviously, I'm talking about vascular, I'm talking about things those things that go on your body. I just refer to them as carpentry, plumbing, and electrical, because that's really all that it is. But being able to push the power. In addition to that, we're giving, on average, pay increases to behavioral health specialists. The number one goal of a primary care doctor and the number one goal of a mental health specialist is to keep people's butts out of hospitals. That helps us lower costs. And then we're doing some tweaking with the rural health situation. We know that having independent hospitals in rural North Carolina is good for rural North Carolina in general. At the end of the day, before I take questions, I want to remind you of a couple of things. Number one, this is the annual report last year from UNC Health Care. We're trying to cut $300 million out of the cost of health care for just the state health plan. UNC Health Care cut $300 million out of the cost of their one facility. And there it is right there. One entity called UNC Health Care cut $300 million of cost out, and they brag about it in their annual report. We're trying to cut $300 million worth of cost out of the whole state as far as the state health plan is concerned. Secondly, as far as the reimbursement rates, let me educate you on what those mean. Whether people in this room agree or disagree, there's some common knowledge that Medicare, not Medicaid, do not get the aid and the care confused. Medicare reimbursement rates are generally thought of as being cost of delivering services. Sometimes you make 4% profit, sometimes you have a 4% loss. But I want to remind you that Medicare reimbursement rates are based on people my age with my premorbidity and all those risk factors. It's not based on a 25-year-old. Medicare reimbursement rates are based on older people. Our plan is on average to pay Medicare reimbursement rates plus on average a 77% profit. Now, you say, gosh, why wouldn't anybody take that? Because some providers are charging us 800% profit. I also like to say, which you may have read in an O recently, there's been an agreement 9 years ago. If you're injured on the job and you need workers' comp, you need health care services because of a workers' comp injury, that service is given to you at Medicare reimbursement rates plus 40%. If you're a prisoner in Central Prison down the street and you need medical attention, a prisoner in North Carolina gets services at Medicare reimbursement rates plus 40%. We are offering twice as much profit as that in the state health plan. So my point of just kind of ending this before we go on into questions, because I'm sure there'll be a few, is to tell you that all we're trying to do is to figure out what's right, get it right, and keep it right. I also want to say that solving these problems is not going to make one bit of difference in my life. It's not going to change my relationship with my wife, our kids, our friends. It's not going to change my spiritual relationship. It's not going to change me financially. Solving these problems is not going to make one bit of difference in my life. But we have hundreds of thousands of public servants out there who you all depend on to educate your kids and protect you from criminals and pave your roads on 100-degree days and all the other core functions of state government. These people are the invisible. And solving these problems is going to make a big difference in their life. Just on public radio in Charlotte the other day, there was a lady whose child is on Medicaid. I suspect that there's people who are working in the Treasurer's office whose children are on Medicaid because they can't afford the family premium. The family premium on the state health plan this year is 1 week out of every 4. You have to work 1 week out of every month to pay the family premium on the largest purchaser of health care in North Carolina. That is inexcusable. And we're trying to take advantage of our largeness, just like we have on Wall Street contracts, just like needs to happen on pharmaceutical contracts. I'll close by just going back to the State of the Union a few days ago, where the President talks about transparency. The President talks about consumers being able to consume health care, both on pharmaceutical and health care costs. The U.S. Treasury Secretary, the U.S. Labor Secretary, and the U.S. DHHS Secretary sent the President 7 weeks ago a 114-page report that talks a lot about the things that we've been trying to operationalize in North Carolina. And I know I'm on camera and people are tweeting out what I'm saying while I'm talking. And we all want the President, every President, to be successful. But the President does not have the opportunity to operationalize the things that he talks about the way that North Carolina can. He can talk about them, but being able to operationalize them in a state this large is obviously hugely important. I appreciate the opportunity to bring these things to you, and I'll be glad to answer any questions.
Mr. Treasurer,
Yeah.
we were told several weeks ago that he had a theater here, what a blessing Medicaid expansion is for this state.
Mm-hmm.
Now, in my previous readings, I had seen that wonderful only 10% that we're going to have to pay really can grow and grow and grow and become a significant part of a state's budget and has impacted other states. Would you expand on that, please?
I won't. What we do every day is sort of like yoga. We breathe and we pay attention to our mat. And our mat is not Medicaid. Our mat is to figure out how to preserve, strengthen, and sustain this one of the largest pools of capital in the United States. So Medicaid doesn't come out of the Treasurer's office. It's a fair question, but probably asked of the wrong person.
Who's the right person?
They can answer that. So, okay.
Secretary Folwell, I think is probably the right person.
Yeah. Yes, sir.
All right.
You mentioned that last year, the return of the pension plan was zero.
Negative.
Negative. Why is that in a year when the stock market went up so much?
Well, it went up so much for 9 months. Yeah. And you know, our returns are going to be negative 1.48%. A lot of the pension plans across the country actually lost a lot more money than that. If you look at from Edwin Gill, Harlan Bowles, Richard Moore, Janet Cowell, if you look at the quadrant of where North Carolina's pension plan has always been in terms of conservatively managed, we're never going to do as well as the others when the thing's going through the roof, and we're not going to ever lose as much as others when things are going through the floor either. So, yes. Yes, sir.
Is it your contention, Mr. Treasurer, let's go back to the endoscopy procedure that you hypothesized, that if a state employee has that procedure and someone who's employed by someone in the private sector has it, that the state employee should pay less?
Well, there's several ways that I'd like to answer that. Number one, as far as the hospital association is concerned, there's at least three, there's maybe 33 major disagreements. Number one is they say that the state treasurer's office and the state health plan is not a governmental purchaser of health care. They say this in a room of 20 people and 6 lawyers like yourself. I can't imagine that the state health plan, which gets all of its money from the General Assembly and from the state employees, I can't imagine what other definition that anyone would be looking for as whether they're a governmental purchaser of health care. So that's number one. Number two, they say, and they now have a word for it, which you're very familiar with, called a compact. There is this unwritten compact that state employees should be cross-subsidizing and paying for the health care of other things that happen in the healthcare industry where people lose money. That compact has never been voted on, never been agreed to, and you can't find it anywhere in the world. The fact is that state employees have been cross-subsidizing other lines of business and other types of revenue that these folks provide to other people across the state. As a fiduciary that you know better than anyone in the room, I have a loyalty and a duty of care to the participants in this plan. And that's what we're exercising. Thirdly, which should make you more nauseated, is that they say that if we're successful in going to reference-based pricing, that they'll just drive up testing on the state employees in order to get their revenues. I don't even know how to even start talking about that without cussing about something. I mean, the fact, you all know how you feel about driving up testing on your kids in the classroom. How do you feel about driving up testing on state employees just because we've gone to reference-based pricing? So at the end of the day, there's a lot of things going on. But the fact is that the state employees, the state health plan, should be taking advantage of our largeness. And we think that if for some reason that on average at a 77% profit, and under our plan, some of them are going to get 100% profit, 125% profit. If you will not provide health care to the people in this state who educate our kids, protect you from criminals, and pave your roads and all the other core functions of state government as on average 77% profit, shame on you. That's how I feel about that. This has been going on a long time. That has, and many other things have led to this liability. You know, our goal here is to take advantage of our largeness, bring transparency, lower costs, push the power down to the consumer. We think by doing that, we're going to be able to lower family premiums because we are way out of balance. This health plan is made up of people my age and my risk factors. We have driven all the young, healthy people out of the plan as far as their young, healthy families because they take the individual coverage at $25 a month. But they don't, we've got to get this thing offset. So I probably didn't answer your question, but I'm sure that sometimes you don't answer people's questions either.
Let me try another one then, since you didn't answer that one.
I'll go on the next question after this one.
Yes, sir. Isn't your proposal really just a hidden tax on people in the private sector whose employees and employers are going to have to pay more to subsidize state employees?
Do you think they should be asking that question too?
They are.
Okay, good.
My question to you is, do you think it is just a hidden tax that rather than being upfront, transparent, as you're rightfully saying is important, this is just a way to tax people in North Carolina who work in the private sector by driving up their health care costs to pay for a part of what the legislature should appropriate to the plan to pay for state employees? Well,
let's get it straight. And you know as well as anybody that my fiduciary responsibilities are to be loyal to the people in this plan and exercise a duty of care. So that's exactly what we're doing. There's no disagreement about that. That's exactly what we're doing. The fact is that you cannot cut the cost of something when no one can tell you what it costs. Even the providers themselves. Have you ever been to a doctor personally and asked them what it cost? And they're going to tell you, no, I'm sorry, they're frustrated. The amount of input we're getting about this reference-based pricing, you can't imagine how frustrated healthcare providers are across the state because they're sick of this system. They did whatever they did to get in the healthcare industry in order to provide care to patients. And so the amount of information we're getting about what's really going on with healthcare across North Carolina is stunning to me. So I'm going to go to the next question. Yes, sir.
Talk about your fiduciary duties.
Yes, sir. You're done. Thank you. Would you like for me to answer this person's question or not?
Absolutely.
Thank you.
Thank you very much. I appreciate that. I appreciate your comments about Carl Boyles. I had a chance to work for him in the 1980s. He was a remarkable person. The presumption in the previous gentleman's question really is that we should sort of slay the messenger here. So the issue you're raising of lack of transparency in pricing of medical services is endemic, as far as I'm aware, to virtually our entire institutional apparatus, all the way from Medicare to Medicaid to Obamacare. And in effect, we're the tail on that very large dog. And until we get transparency in the pricing of medicine, then I don't necessarily disagree with your comment, because if you push the bubble and run down one place else, it may pop up somewhere else. But the fact is, it's the lack of transparency in the pricing of medical services and the delivery of those services, I think may be the issue. Do you see that as the issue? And I understand you want to protect the people you're obligated to protect. That's your duty and responsibility. But in looking at it in the larger world, I don't see us as having a market for medical services because I can't see the price. Comment, please.
Correct. Well, this is not me just saying these things. This is North Carolina Journal of Medicine talking about the high price of health care in North Carolina. This is the Wall Street Journal saying, why does health care cost so much? This is the Wall Street Journal with major exposés talking about secret hospital deals between hospitals and insurance companies which drive up prices. This is an explanation of benefit that doesn't explain the benefit of a damn thing, except for a $165 facility fee for $11 flu shot. Everybody in this room knows this is happening and going on. And then when you go to another facility, you're asked to sign this pad and people don't know what they're signing. It says, thank you for coming in today. We don't know the exact type or the extent of the services you may need, so we'll be unable to provide you with an estimate of your liability. However, the typical charge that could be charged to anyone based on all of our visits to our department for facility fees could range between $67 and $1,090. Now, I know $67 or $1,090 doesn't make much to probably you or I in our parts of our life. In one part of my life, it meant everything. That was the end, actually. But I can tell you that people who are going and signing these electronic pads and getting health care services, they don't know what they're costing. And then it ends up putting them in a financial spiral with a credit score and all these other things that are going on. And back in our day, you know, a credit score didn't affect how much you pay for your liability insurance. Probably didn't affect how much you pay for your homeowner's insurance. Didn't affect what kind of terms you got on your Verizon bill. That stuff matters today. And you're putting people in jeopardy when you're having them sign things where they don't know what they're paying for. So to answer your question, to bring transparency to this system is the #1 goal. People have a right to know what things cost. The state health plan, as a fiduciary, should know not what we're being charged, but what we're supposed to pay. The fact is, going back to the premise of your first question, how in the hell am I supposed to know if I'm on the same plan with our third-party administrator and two people like you and I go in for the exact same knee surgery? I don't even know that I'm not cross-subsidizing Bank of America, because nobody knows what we're supposed to pay. Now, I haven't brought up Blue Cross Blue Shield, but let me do that in an effort to say this. Everybody says, go to Blue Cross Blue Shield, that's where all your money is. It's public record that we pay Blue Cross Blue Shield less than $100 million a year to administer this plan. They're a third-party administrator. They are just the back office. This is a self-insured plan. So even if I went to Blue Cross and Blue Cross got generous and said, we're just going to do the state health plan back office for nothing this year, it's still not going to solve the problem. We have an option here. We could just run this place into the ground, or we can find and fix. And that's exactly what we're doing. We're finding and fixing.
John?
Dale, a comment and a question. The comment is, if we have a balloon and it keeps blowing up, will we end up doing a squeezing part of it and the other part sticks out? That's better than doing nothing, because otherwise it's just going to keep blowing and blowing and blowing and blowing up. Maybe we'll notice the other parts stick out, and that'll lead to the ultimate solution. This system that you're describing plays off of Medicare reimbursement.
Mm-hmm.
So you're working off of that, applying the 77%. But are you concerned?
On top of that.
On top of that.
Let's get that straight. You're right. And some even higher.
Are you concerned that you're working off of a set of reference prices for Medicare that are themselves, I mean, obviously nothing's perfect, but you're kind of hitching your wagon to something that in some cases might reference something that makes sense, and in other cases is quite highly disputed. I know you don't have any control over Medicaid reimbursement, Medicare reimbursement rates, but you are referencing them for the system.
It's because it's the only set of prices I have. You know, it looks just like this. You know, when I talk about Medicare reimbursement rates, you can look it up on the internet right now. you know, it's a CPT code, and this is what it is. It looks like this instead of like this. So you're in charge of who?
Treasurer, are
Yeah.
there experiences you draw from other states that may have moved to reference-based pricing that are already?
We didn't know this going in, but there is another state that's done this, but it's smaller than ours, and it's Montana. And occasionally we get a call from them because they look us up and catch up and figure out what we're doing, and they tell us that we're acting normal and the other side's acting normal. So congratulations. So, sorry.
Do you think eliminating certificate of need laws would be meaningful in this?
Well, that goes back to the yoga mat. So CON is something that a lot of people in this room are interested in. Even in 8 years of the General Assembly, I never got involved in this CON debate. I always focused on something else. But there's a lot of movement toward doing something about CON. Yes. One more.
Joe, you'll get the last question.
So I'm going to change this from healthcare to one of the topics that you didn't address in your talk, but that you and the auditor have raised flags about before in the local government commission, and the staffing and the financial condition of local governments. And the concerns that you all have raised is that they may not have the ability to run into the future, and that's the whole reason why the local government commission was created in the first place, because they ran out of money back in the 30s. So in the however much time we have, could you comment on where you think reforms can be done with local governments and where you're concerned?
Well, the local government commission is another one of those invisible things that no one thinks about. As you correctly stated, after the bankruptcy of Asheville and the Depression, it was something that was created in North Carolina, and for decades, we're the only state that had something like this. So for those of you who don't know, but we have some former county commissioners and other representatives here, there's 1,315 entities that come in front of the local government commission in order to be able to borrow money on a tax-exempt basis. Water and sewer districts, Raleigh, County of Wake, Raleigh-Durham Airport, all across Wake Forest University, Salem College, private, public, all across the map. There are over 125 entities, including 14 counties, that are on the unit assistance list currently. 70 cities, over 14 counties that are on the unit assistance list. And then we have a watch list that has another 130 on it. So we're looking at nearly 250 of the 1,300 entities that normally come in front of us to get blessing about their financial solvency that have some kind of issue. Some of these are very serious. Wilkesboro, they're on the unit assistance list. How serious is it? They have the lowest water rates in North Carolina. Why is that? Because Tyson Foods runs a lot of water through there. So they're on the list because they're vulnerable to one employer. But that's sort of the outlier. We have situations in North Carolina, especially in rural North Carolina, where we could see water and sewer rates go to $150 a month. And everybody talks about the two North Carolinas and all this other. I can tell you, as the chair of the local government commission, I'm very serious about access to water and sewer, access to health care, and access to good public schools in rural North Carolina. And there's nobody, not because I'm the treasurer of North Carolina, that has more constitutional and statutory responsibilities for those issues than the treasurer of North Carolina. So thank you for the question, but it is a serious matter. We're affirming, trying to exalt the local government commission, but the fact is we have a serious situation with talent. We have people who are getting accounting degrees but not sitting for the exam. We have, in some instances, and you can ask the state auditor, she'll give you a really tip-of-the-tongue opinion about this. We have auditors who don't know how to audit. And this is a very bad situation, especially for rural North Carolina, so we're trying to affirm that. As I leave, let me just thank you all for your interest. This article came out of Becker's last week. Hospitals, not physicians are driving up healthcare across the country. This is the CFO's trade magazine for hospitals. The Trump administration talks about we want to take the mystery out of what people are being charged. All kinds of things about cross-subsidization. Blue Cross Blue Shield's being sued in Chicago for possibly the employees of the city of Chicago cross-subsidizing other things within their book of business. This is a very wide and deep situation. But the fact is that we're trying to figure out what's right, we're trying to get it right, and we're trying to keep it right as keepers of your public purse. Thank you very much.
Thank you, everyone. Appreciate you joining us for a spirited discussion on the issues. That's what we are all about. Hope we will see you again. Next week, Professor Andy Taylor from NC State University will be here and commemorating President's Day. Have a good afternoon. Thank you.